So do you, because a lot of medications are under generic names and the patient may not realize, or like you said, the doctors, that this is the same medication that was prescribed, do you go through and do like a check?
If the client will have us do that and would like us to do that, that is absolutely something we'd like to do.
Okay.
And we have a tool that is able to recognize the various names of medications in various countries, in various forms, in various ways that it is delivered, whether it's oral or something that's injected or something that's applied topically, maybe the same medication under a different name. There could be a lot of different possibilities, and so we do want to make sure that people are cross-checking their medications and taking the right medications at the right time for the right reason. One of the things we encourage people to do is ask 3 questions. What is my problem? Why do I need to do this? And how will this help me?
And have they been diligent in doing that?
Sometimes they are. Sometimes they're involved emotionally, or their judgment is clouded because of their pain or the thought of the diagnosis that they may have been given, so that we are asking those questions for them. And I can't take full credit for those. Those questions have been put forth by the National Safety Foundation, and they have a campaign, Ask Me 3.
And in the event that they can't, do family members step in and advocate and ask these questions on their behalf? Do you find that a lot?
Sometimes they do. Again, sometimes they need to be helped to realize that there's other questions that they can and should ask. We have kind of become accustomed to the model where whatever the doctor says, they must be taking everything into account and paying attention to everything that we could possibly need. And whatever they say, we should not dare challenge or question them. And doctors do the best that they can, but they're human beings. And they have a lot of rules and regulations now that are pulling upon them, including the electronic health records, meaningful use regulations that have come out of what's called the HITECH Act. So because of that, it's important for patients or family members to actually pay attention. You don't want to interrupt a nurse, for instance, while they're actually administering, but before they administer, you want to ask them, what's my problem? Why do I need this medication? And how is it going to help me?